Okay, before I would start this procedure, I would go ahead and wash my hands, and then when I get into the med room, go ahead and put on clean gloves and go ahead and start getting my supplies together. Okay, my name is Ashley Caldwell. I'm going to start my IV insertion, my skill. So the first thing that I would do is to check my MAR, make sure that there are actually orders for this patient. And in doing so, I would go ahead and assess the type of IV that I'm doing, gather all my materials together, check for allergies on this patient, check lab values, and to check why we're doing this. And for this instance, we'll say that this patient is preparing for surgery and we need to get IV access for pre-op. So we would use a 20 gauge, just in case, 20 gauge or larger for blood transfusion if needed. So go ahead and gather my materials together. I will get my IV starter kit together and make sure I have my catheter. Go ahead and get my tubing primed. I don't need gloves at this point, but I'm going to go ahead and put them on. Okay, and then let's see, go ahead and get my needle syringe together. And I would draw up 6 ml of saline for this. However, I don't have 6 ml. I only have a 3 ml, so I will have to simulate. And this would be a new bottle or a pre-filled syringe. If not a new bottle, I would use alcohol to wipe off the top of it, maintain sterility. Go ahead and pull back. Get my 3 ml here. Recap. Okay, and then this would be brand new, so I would open it, take this needle off, discard it, connect onto here, and prime this tubing to make sure that air is out of it. Okay, and primed, and to clean it off. Stick that back in there. Okay, I'm going to prep my tape. To the tray. Okay. That I don't have another tegaderm to cover the dressing site, but I will use a piece of tape to simulate my tegaderm. Okay, and now I do have tegaderm. So I have my tegaderm together, I have everything together that I need. So I'd go into take all my supplies with me, go into the patient's room. And upon entering the room, I would knock. Hi, Mr. Smith, my name is Ashley Caldwell. I'm going to be your student nurse today, and we're going to go ahead and get an IV started for you since you are going into surgery. We're going to go ahead and need to get that placed. Can you verify your name and date of birth for me? And Mr. Smith would reply, yes, my name is Mr. Smith. My date of birth is 03/22/1980. And then I would also ask if he has any allergies. So no, he does not have any allergies, so we're good to go there. To choose an IV site on this patient, I would make sure that he did not have any, well, first I would ask which side was dominant, and I would go with the non-dominant side. And then I would, since it's he, obviously mastectomy wouldn't work, but I would make sure he didn't have surgery on that arm. No pain, no redness upon looking at the arm that I'm choosing. And for this patient, we're going to go with the right arm, and I'm looking at it. I'm going to go ahead and make sure I do have veins on this arm by pushing, making sure they're nice and fluffy and squishy. Okay, and then I would apply my tourniquet approximately 4 inches above the site to where I'm going to go. Okay, and again, I already have gloves on. Go ahead and prep my site here. So it looks like this would be a prime area to go. So I'm going to go ahead and cleanse in circles, going from inside out. I'm not going to touch that side again. I have everything that I need. My tape, my needle catheter, my there. Okay. I'm going to go stabilize the site, bevel up. Once I have felt the pop, I'm going to lower Then I'm going to advance my catheter. I'm going to hold pressure, release, and then I'm going to get my tubing. You can tell that there's been a lot of fluid pushed into this. Okay, and then I'm going to do ASHA method. I'm going to aspirate to make sure that I still am in the vein. Okay, and then I'm going to saline in. I'm going to unclamp this first. That's great. And saline, saline, stop push method, stop push method, stop push method until I have inserted 3 ml for this one. Okay, and then as I'm doing, I'm going to lock this back in. Making sure I'm not going to pull that out. There we go. Okay, so, and then I'm going to disconnect this using my tape. Actually, I'll put my tegaderm first. I should have pressed this before. Pause it. I have my tegaderm, so I'm going to apply tegaderm over the site. Okay, take this off. Take this off. Okay, and I'm looking at the site, making sure it's not infiltrated, looking for redness, swelling around the area. And then I'm going to document. Time is 17:03. Date is 9/3 with my initials. Okay, time, date, initials, and I'm going to put this on the time, date, initials, and gauge of catheter, and we're going to place this on the outside so it's not covering up the hub, and then we're also going to take the tape and secure the tubing down so it's not just hanging out. Okay, we're going to secure that down and this from underneath. Okay, and from that point I'm going to ask the patient how is it going, if they have any pain, if they're able to move their extremities, and then dispose of my needles. This would go into sharps immediately. Go ahead and stick it back in here. Okay, and then as far as documentation, I would go into the more. One attempt, the site would be in the right forearm, size would be 20 gauge, type would be INT, client response, client's doing well with it, well tolerated, client teaching, don't tug on it, call me immediately if you have any redness, swelling, or pain at the site. Okay, and then